My presentation is on multiple sclerosis, or MS. MS is an autoimmune disease where the immune system attacks the myelin that covers the axons of neurons in the central nervous system and the optic nerves. This results in the disruption or the blocking of electrical signaling throughout the body, and it can also cause nerve damage and inflammation. The primary cause of MS is unknown, but it's presumed that a combination of risk factors contribute to the development of the disease. People are typically diagnosed between 16 and 55 years old, and women are actually 2 to 3 times more likely than men to develop MS. A history of MS in the family can also increase the likelihood of development. And then Caucasians are actually at a much higher risk of developing MS than any other race. And finally, interestingly enough, climate is also a risk factor. So MS is much more common in countries with temperate climates, such as Canada and the US and Europe. It is also thought that pre-existing conditions can increase the likelihood of the development of MS. So for example, some viral infections have been linked to MS development. Proteins in the spinal fluid of people with MS have been typically found in the spinal fluid of people with other nervous system disorders that develop due to viruses, such as the Epstein-Barr virus. The presence of other autoimmune diseases, as well as smoking, both also increase the risk of developing MS. So there are two kind of subdivisions of MS. The first is primary progressive MS, which is illustrated by the graph on the bottom right here. And this one's characterized by gradual onset of symptoms and where the disease progressively gets worse over time. And then secondary progressive MS is characterized by alternating periods of relapsing symptoms and periods of remission. And these periods can last anywhere from weeks to months to years. Symptoms vary greatly in people with MS. They depend on which areas of the body have been affected by the nerve damage, and they also tend to vary throughout the course of the disease for an individual. However, typical symptoms include numbness or weakness in the limbs, lack of coordination and gait, feelings of electric shocks, or impaired cognitive functioning. As the disease progresses, symptoms worsen and typically implicate mobility. Additional symptoms of MS may include vision problems, tingling and pain throughout the body, and in severe cases, paralysis may also result from MS, along with impaired brain functioning. So unfortunately, there's no specific test to diagnose for MS currently. Typically, a process of differential diagnosis is used, which relies on a process of elimination of other conditions that would produce the same symptoms of MS. So blood tests can be used to rule out other diseases. A spinal tap can reveal abnormalities in antibodies that are associated with MS. MRIs are typically used to reveal the lesions on the central nervous system that result from MS. And then something called evoked potential tests, which record the electrical signals that are produced by the central nervous system in response to a stimulus. So the measures of the speeds of electrical signaling in the body can reveal lapses that can be attributed to MS. In MS, the immune system degrades the myelin on the nerve cells in the brain, the spinal cord, and the optic nerves. Immune cells aren't typically found in the nervous system. However, in people with MS, the blood-brain barrier is compromised and immune cells enter the nervous system. Once T cells and B cells are in the nervous system, they recruit other immune cells and produce inflammation in the nerves, which is shown in the second picture here. B cells also produce antibodies that target the myelin on the axons of neurons. And both of these combined results in nerve inflammation and damage throughout the body. MS itself is rarely fatal, and although there is a slightly shortened life expectancy of an average of 7 years associated with the disease, this is primarily due to the complications that result from MS instead of MS itself. In terms of mobility, about 2/3 of patients never end up needing a wheelchair, but most walk with the help of a cane as the disease progresses. So unfortunately, there's no known cure for MS. However, general treatment options usually focus on either speeding up the recovery from attacks, slowing the progression of the disease, or symptom and pain management. So treatment for the attacks of MS themselves usually looks like corticosteroids, which reduce nerve inflammation, or plasma exchange, where a blood sample is taken and the blood cells are separated from the plasma, and then the plasma is exchanged for an albumin protein solution. And this treatment is often used if symptoms are new, severe, and unresponsive to steroid treatments. So there's really only one option for the treatment of primary progressive MS in terms of medications, and this is Ocrevus. And this aims to slightly decrease the risk of progression, and it's actually a humanized immunoglobulin antibody medication. So injectable treatments for secondary progressive MS are one of three options in terms of medications for this strain of the disease. And these are usually used to aggressively treat MS as early as possible to lower the rate of relapse and slow the progression of the disease. So beta interferons are most commonly prescribed, and these are injected under the skin or into muscle, and they work to reduce the frequency and the severity of relapses. And then glatiramer acetate is also injected beneath the skin, and this one actually prevents the immune system from attacking myelin. So there are several different options for oral treatments for MS, and all of these reduce the relapse rate, and unfortunately most of them are harmful to fetuses, so this provides some difficulty in treating women who are pregnant who also have MS. Finally, there are infusion treatments that can be used for secondary progressive MS. Most of these aim to, again, reduce relapse rates and slow disease progression. Unfortunately, some of them increase the susceptibility of the body to viral infections of the brain and to other autoimmune disorders. However, they can be effective in treating MS and to limiting the nerve damage that's caused by white blood cells in the body. Physical and occupational therapy are also used in the treatment of MS, mainly to adjust daily life and improve gait and mobility of people with MS. Other medications can also include muscle relaxants and medications that aim to reduce fatigue and increase mobility. Current research on MS includes research on how to better diagnose the disease. So biomarkers have been in the process of being studied for the past few years as researchers try to determine how best to diagnose MS. One of these biomarkers that has been identified is called neurofilament light chain. And this is a biomarker that indicates axon degeneration. So if this can be developed into a diagnostic test for MS, it would be much more non-invasive and a cheaper diagnostic option. Studies recently have also identified ursolic acid in some fruit peels and herbs that's effective at promoting nerve cell repair and restoring myelin. So heat intolerance is often associated with MS, and it can temporarily make symptoms worse. This might include a hot shower or overheating from exercise. Vitamin D deficiency and low exposure to sunlight has also been found to increase the risk of MS. And oddly enough, studies have shown that MS symptoms improve while a woman is pregnant, perhaps because the body naturally prohibits its immune response to protect the fetus. And then finally, Canada has actually the highest rate of MS in the world.